assessing hip flexion for my patient. So essentially, we're going to use a goniometer. I'm going to palpate the greater trach. Alright, Hannah, what I want you to do is go into hip flexion. So you're going to bring your knee up to your chest. And you are at 105. Back down. Perfect. And then we'll repeat bilaterally. So all I need to right hand, I want you to bring your knee up towards your chest. Perfect. And then you are at 100 degrees. Alright. Okay, so I'm going to be measuring Hannah's measurements for lateral flexion. So I'm going to be starting just lateral, superior lateral to the patella. And then we're going to go up. Fingertip width. Go ahead and lateral flex. Nice. Oh, you're surpassing that. Alright, go ahead and go back to neutral. Right. So keep in mind that for a patient case, they were able to laterally flex at 10 centimeters above the knee, but obviously Hannah's norms are very much different from that. So for this manual therapy technique, I'm going to be demonstrating hook-lying distraction of the lumbar. So I'm going to be placing the belt, joint mold belt underneath just the back of the knee. I'm going to stabilize at the patient's feet, and then I'm going to provide that distraction. And we're holding it, essentially trying to distract the vertebral bodies to lessen up the pain that our patient is experiencing. I'm going to have you go ahead and go into hip flexion. Nice. So you're at 115. Great. Go back down. And then compare bilaterally. All right. Go ahead and go over to trunk flexion. Hip flexion. Sorry. You're good there. So now you are at 120. Go ahead and side bend. Nice. Alright, so there is an increase. Alright. Go ahead and go back to neutral. We'll compare bilaterally. Okay, so I'm going to be explaining the goal of this exercise, which is the bird dog. The goal is for the active phase. Phase 2 is to promote range of motion, and then also core stability to help with that posterior chain for the low back. So what I'll have Michaela do is lay on her back, and you're going to bring your knees up to a 90, and then also hands up. She's going to be alternating her arms and legs, doing a bird dog. Ideally, in terms of dosage, you want to make sure that your patient can tolerate the amount of sets and reps that you prescribe. So start with 30 seconds, and then after 30 seconds, I'll prescribe Michaela to 2 sets of 5 reps. So you're going to alternate legs and arms. There you go. Nice and controlled. And the expectations in terms of pain for this patient, she might feel pain if she's not activating the core appropriately. So you want to make sure that you cue them on stabilize the core, make sure you're tightening it, and then slow and control movements.
Okay, so now we are in phase 3, which we are trying to increase the strength, endurance, and power of our patient. So what we're going to be doing is bird dogs. So what I'll have my patient do is go ahead and get in a quadruped position. We originally had our patient do this, so for 30 seconds she was able to do 15. So right now what I'm going to have my patient do for sets and reps is 3 sets of 10. So I'm going to have my patient with the resistance band. It's going to be looped around her foot, and then she's going to be holding it with the opposite hand. We're going to do opposite arm, opposite leg, extending. So Jada, can you go ahead and perform one? There you go. Out and back is 1 rep. So then that would be 2. So as she's doing these, we'll be checking in and making sure she's contracting at the core. Just having those mental cues. So if she's not contracting at her core, expectation for pain could be that she would have some discomfort in her lumbar region just due to her pathological history.
So for phase 4, we're focusing on the aggressive phase, which is going to be for proprioception, coordination, agility, and return to play. So for our athlete, she is a football lineman. So with the progression of the bird dogs, we're going to be doing it on an AirX pad, one underneath her knees, one underneath her hands, and she's just going to complete a normal bird dog. With this, she's going to want to be slow and controlled. And the expectation to pain is that she should have no pain with this as long as she is contracting her abs. If there is pain, we need to re-examine those ab contractions. And as well, since she did 15 and 30 seconds, similar to how we timed the other 2 phases, she will be doing 3 sets of 12.